I thought I would appear and just talk very authentically because that's what I keep saying that I'm here to do. But disclaimer, I feel a bit shaky right now. Somebody asked me if I would review the first chapter of a book she's writing, which is related to IBD, and it was an experience of a bowel perforation. And even though I don't know why I started crying. I do know why I started crying because you relate to these things, and it brings stuff up. So even though like I can't formulate right now because this is a very real response. So anyway, it made me think about my experiences as someone who deals with like blockages and things quite a lot. And it also reminded me of an experience in hospital when I had sepsis, which was after my first surgery and did not put a drain in. I think I'd had a day after surgery, and then it was the day after that. I think it might even have been day 3. And I was struggling to breathe. The pain was really incredible, and I kept complaining. I think I'd done some shouting. The pain was just continuing to go up levels to what it had been in the previous time. So I knew something was wrong, but I was struggling to communicate that. But I did keep trying to communicate that, and nurses kept saying things like, "It's gonna hurt. You just had surgery," and I don't know if I said it properly, but obviously in my head I had the understanding that, well, I know how I've felt for the last few days, and I know how I feel now, and I know that this is worse, and it's progressively getting worse quite quickly. Couldn't take a breath in properly. There was pain all through my back. Ooh, I could feel it all. And yeah, as I say, I couldn't take a proper breath in. And thank God there was a shift change, because the nurse that came on shift did take me seriously, and she took me seriously immediately. And that led to me being rushed around on the cart, and she was giving me oral morphine, and it was like a little capsule that she kept pulling the end off and dripping it into my mouth. And I went for scans, and it turned out that I'd got sepsis, but that somebody wanted me to sign a form to have surgery, and then all I knew was that I wasn't all I knew was that I was not straight-headed enough to sign the form. So even though I knew how, and I know on some level how urgent it was, I couldn't sign the form, and I just said, "I need you to ring my mum." And I don't remember my mum being there until after. She obviously came, she obviously signed the form, and I obviously had a surgery. An emergency surgery to clean me back out. And I remember waking up and my grandma was there. And do you know how many times I've said I do not understand people who would pull their phone out and take a picture of themselves crying? But I knew that the shakes are going away now. I knew that I had something raw to say, and I don't know who it will benefit, and I also don't know who it will trigger. So I really need to write that in the post and hope people see it. Yeah, here we go. See, real life, real inflammatory bowel disease, real surgery, real PTSD, just real trauma. Because I didn't know if I was going to survive or not. And it's difficult not to be traumatized by that. And I just want anybody else to know who's potentially gone through similar, that it is normal to be traumatized by that. And yes, things can get better and you can live alongside the trauma. I don't think you can ever be someone that's not living with PTSD anymore. You just get to a point where you find tools that can help you regulate yourself faster when this happens. Okay, second story time. And this one is, again, it's following surgery. I'd had a bowel surgery. I'd had, you know, normally you have a PCA for the morphine, so you click it and it administers it when you click it, when you need it. Apparently the wrong line had been put in, so what actually happened was it never stopped administering, so I was gradually getting overdosed on morphine. And I remember having visitors, and I remember being sick, and I remember having to have my nightie changed multiple times because I'd vomited on myself, and I was just very, very in and out of consciousness. But that's not that abnormal, because when I'm in the hospital, as soon as I go in, if I'm an inpatient, dissociate. I've gone anyway. So I'm never really there. So floating in and out wasn't that weird. And I did then at some point realise, when this nurse was having to hold me upright, that I didn't really have much control of what my body was doing. And then nothing. I remember vomiting into the paper hat, the cardboard hat. And then I remember being laid in my bed and people around me, multiple people around me, you could tell that they were panicked. And they did not know what was wrong with me. They were talking about how shallow my breath was. And I was just laid there and I couldn't move my body. I couldn't lift my head. There was no chance of me communicating with them. I couldn't speak. But they were talking about my shallow breathing. So I remember thinking, oh, I'll breathe deeper so that they know I can hear them. But I couldn't breathe deeper. And then that really freaked me out because I didn't even have control over my own breath, which then immediately made me think, if I've got no control over my own breath, then at some point my breath might stop and I won't be able to do anything about it. And it wasn't aided at all by the fact that I could tell the people around my bed were actually worried about my life and me not continuing with it. So, and that was it. I remember the panic. I remember not being able to control my breath. And then the next thing I remember is feeling this shot in my wrist. And then a shot in the other wrist. And I'm not sure how long it was between those shots. I think the medication is called naloxone, which brings you out of an overdose, of specific overdoses. And then I shot back up to the surface, and that is exactly what it felt like I was beneath the surface. I'd been pulled underneath the surface, and then the drugs shot me back up to the surface. And there I was again, to live with my trauma.